Hey everybody, it's Adam Farkas. Welcome to the show and thanks for being here. And today, as you can see, I'm by myself. We don't have Paul here as usual.
But I'm here.
Paul is here. He's 20 miles
Hi,
away from me,
everyone.
actually.
I'm just 20 miles away.
You know, we have a disaster here in Portland. We have an inch of snow, so it's like the apocalypse or the snowpocalypse. Everyone is just freaking out, and Paul couldn't actually make it here on an inch of snow, so that's Portland for you. But, you know, today we actually have a really interesting topic for you, and it's all about sort of finding those hidden opportunities for practice growth. You know, I think a lot of people kind of wonder after a while, well, what do I do next? Where do I grow, and how do I grow? And today we got a little bit of advice for you, and not just from me and Paul, but from an expert as well. So we're very fortunate today. We have Dr. John Shackett, and he's here to talk about these hidden opportunities for you. And just to briefly tell you a little bit about John, you've seen him before on the show, so I don't have to go too in depth into his bio here. But as you know, he served as a clinical investigator for many manufacturers. He's past president of the Colorado Optometric Association. And so he lectures, you know, widely in the U.S. and internationally. So you probably have seen him when you were doing your CE as well. He's a contributing editor for Review and Optometric Physician and Optometry Times. And his practice specialties include contact lenses, management of dry eye, allergy, CRT, refractive surgery, and post-cataract management. So he's a Renaissance man, right?
And he also practices in the high elevations
Yes.
in the Denver area, which is contact lens hell.
Yes, it is
So
a...
with the low humidity and the high elevation, the contact lenses really have to work very well.
Yes, if you can fit a contact lens there, you can fit it anywhere, right? So thanks so much for being here, John.
Yeah, absolutely.
Thank you, guys. I appreciate it. Thanks for having me.
Okay. Well, John, you've been practicing optometry for quite some time now, and you come across all sorts of patients, all types. What patient populations do you consider to represent the biggest potential for growth in your practice?
Well, I think the first thing I'd like to thank you for saying just sometime. You know, it's been a long time that I've been involved in optometry, and one of the nice things about that is you have some perspectives, and one of the perspectives that I've had with that is that there is some real potential growth out there in areas that we don't even think about on a day-to-day basis. The first one that we do think about is the presbyopic population. That's one group we all realize there's great potential, but what may be surprising really to some is that astigmatics are the other group.
Astigmats? Are you sure?
Yeah, I really am. What I've been seeing in practice is many astigmats that are still being told that they can't wear contact lenses. It's just not an option for them. And they're going without, even though a large part of the patient population has been diagnosed with astigmatism. So they're either not wearing contacts or they're wearing a spherical equivalent lens with a very small number actually wearing toric lenses, and it's very common.
Amazing. The number of astigmats wearing toric lenses is so low. In your practice, you find it difficult to get astigmats to commit to wearing toric lenses?
Well, it really isn't. I think that's, though, what makes the opportunity present at that point, this low number. The data actually shows us that over half of the astigmats are candidates to become toric contact lens wearers.
So I guess, you know, it's important to find the right lens for each patient. But with astigmats, are there any sort of special considerations that you take into account before you try?
Certainly there's considerations that are major factors. Contact lens dropout, for example, is not really a foreign concept.
Exactly. And in fact, astigmatics are more likely to have dropped out of contact lenses than non-astigmats due to vision issues. So would you say that it would be a detriment not to find the right toric lens? Because improving comfort and the quality of vision for astigmats can help keep them in lenses longer, which benefits not only the patients, but the practice as well.
No, that's for sure. I mean, you know, many of us out there are familiar with the work of my good friend John Rimpakis, who he conducted a study in 2010 on contact lens dropouts due to comfort issues.
And I guess, and John, of course, likes to also talk a lot about practice management. So, there's this sort of secondary outcome of having patients drop out, right?
That's exactly right. And in his outcome, he said, that every patient that doesn't drop out of contact lenses could possibly bring about another $21,000 to the practice, slightly higher, slightly lower, depending on the practice. But, that was 2010. And if we assume even just a small amount of inflation, that number is even greater today. That's why I think it's critical to uncover the needs of our patients and try to fit them in the right contact lenses, basically, that fits their lifestyle.
John, from your perspective, what are the key factors in a toric lens that provide the greatest opportunity for successful fitting and patient wearing experience?
Well, I think first of all, as a primary eye care provider, it's my responsibility to help ensure some type of fit success. When fitting a toric lens, I know my patients will be comfortable if the contact lens does several things. One, that it's stable on the eye. Two, it supports the tear film. Three, it has optimal wetting. Four, has some resistance to lipid deposits. And five, has a wearing schedule suited to their own lifestyle.
So what exact criteria are you looking for when you consider comfort for your contact lens astigmatic patients?
Well, I think we can all agree that a brand new contact lens is typically comfortable. But what matters to me the most in this whole process is that comfort lasts. With my astigmatic patients, it's important for them to experience not just the comfort on insertion. They need comfort throughout the entire wearing cycle, whether it's all day or all month.
So, based on your experience and the information you receive from your patients, what's important to them? Do you have a go-to toric contact lens? Which contact lens do you fit first in your practice?
Well, over the last number of years, I've been reaching for Alcon's toric contact lenses first in my practice, simply because they have lenses to suit all patient lifestyles, and they have lens replacement schedules to promote compliance. And we still have to talk about compliance. Naturally, higher compliance with replacement schedule is good for our patients' ocular health, but it's also good for our practices, because data shows that patients who are more compliant with their wearing schedule return more frequently for their annual eye exams. So it certainly helps us as well. And with Alcon's toric contact lenses, I have the option of choosing either a daily disposable or a monthly replacement lens. And I realize too, Paul, that every lens is a disposable lens. It just depends on when you dispose of it. But in patients' eyes, there's definitely a difference of whether they want to dispose of it on a daily basis or whether they still like to continue on with a monthly replacement lens.
Sure. And I guess getting down to the nitty-gritty, talking about technology, so why are Alcon's toric lenses keeping your patients comfortable?
Well, let's start with a Dailies AquaComfort Plus toric. Imagine the eyes are constantly being refreshed. These lenses, they release a blink-activated moisture with every blink to provide comfort throughout the day until the end of the day. Polyvinyl alcohol is released with every blink and helps support the tear film stability. It also helps maintain wettability, comfort, and clear vision.
Is polyvinyl alcohol the only component of Dailies AquaComfort Plus toric contact lenses?
No.
That contribute to comfort throughout the day?
No, not really. Dailies AquaComfort Plus toric lenses actually contain 3 different moisturizing agents: hydroxypropyl methylcellulose, HPMC, polyethylene glycol, or PEG, and polyvinyl alcohol, which is PVA, all of those for enhanced comfort. They work together from the first blink at insertion throughout the day to the end of the day. So HPMC, for example, enhances comfort at lens insertion. PEG within the lens packing solution provides moisture during the early part of the day. And lastly, PVA, which is a part of the structural component of the Dailies Aqua Comfort Plus toric lens is released into the tears to spread over the ocular surface with every blink.
So typically, who are you prescribing Dailies Aqua Comfort Plus toric lenses for?
Well, let me just give you a profile of somebody we just fitted last week. Her life, this lady demands a lot from a contact lens. She really travels frequently for work. She's an avid tennis player. She also has ocular allergy, and she needs a comfortable lens that provides flexibility and clear vision. So a number of things with that is a key factor.
Right. And daily disposables, as I know from hard-fought experience, are great for allergy sufferers. And yeah, I don't think I could actually go back to wearing anything other than that.
I think we find that as a general rule, Adam. I mean, I agree with you. Daily disposables are great for allergy sufferers. You know, studies are showing us that patients specifically wearing Dailies Aqua Comfort Plus lenses experience a reduction in the percentage of time they experienced ocular allergy symptoms, such as the stinging, the redness, the excess watering when measured against their habitual lenses.
Right. Well, great. So, you know, I guess I'm curious, you know, you mentioned a lot of these benefits. How are these same benefits achieved with Air Optics for astigmatism? And how is the lens sort of different from the technologies in the Dailies Aqua Comfort Plus toric?
Well, Alcon's designed the Air Optics for astigmatism with what they call Smart Shield surface technology. It's a patented surface treatment that resists lipid deposits and delivers outstanding wettability by minimizing the amount of silicone exposed to the surface. And if you're going to wear a lens, you know, for a month before you throw it away, you want to be able to have that surface as clean as possible.
Right. And why specifically would Smart Shield be important to a toric contact lens wearer?
Well, definitely because it keeps the lipids in the tear film where they belong. We know that the lipids are an important component of the tear film, but problems significantly arise when those lipids are deposited onto the lens and they become oxidized and broken down in that environment, and they introduce discomfort. We already know that discomfort is one of the top reasons astigmats drop out of contact lenses versus non-astigmats. So if we can prescribe lenses that help promote comfort throughout the wearing schedule, it's a win-win for my patients and my practice.
Right. And can you sort of paint a picture of a typical Air Optics for astigmatism patient in your practice, what they might look like, or you know, their demographic?
Sure. There are patients in my practice who find that replacing lenses monthly is the most convenient way to replace. And like I said, I mean, every lens is disposable depending upon when you dispose of it, but they like the monthly aspect of it. And Air Optics for astigmatism contact lenses are perfect for that aspect of their lifestyles. Some of my patients that are wearing Air Optics for astigmatism have experienced discomfort and interrupted vision with their habitual toric lenses. They're busy with work, family, friends. They're very active socially. So that's certainly a good patient to be looking at for staying in a monthly replacement lens, but getting them in a better one than they were in.
Right.
So we've discussed the comfort, but stability is also part of the toric contact lens success. Where is need stability in the lens to achieve clear vision? How is this addressed?
We know stability is important. Dailies Aqua Comfort Plus toric lenses have what Alcon calls their unique precision curve lens design. And this design actually includes dual thin zones. That is, the lens profile is thinner at the top and at the bottom of the lens. And then the lens uses the blinking pressure of the upper and lower eyelids to maintain that rotational stability.
So blinking helps to provide comfort with the release of PVA, but it also helps stability. It also helps to stabilize the lens. That's a great feature.
Yes, it is. And in addition, the back surface of the lens helps fit the toric surface of the cornea. A study that examined lenses with precision curved lens design demonstrated that 99% of lenses had less than 5 degrees rotation with the blink. This is key, obviously, in preventing blurred vision.
So is this the same design used in Air Optics for astigmatism contact lenses?
No, actually, it's not, Paul. In contrast, Air Optics for astigmatism contact lenses have what Alcon calls a precision balance 8-4 lens design. And that design includes 2 points of stability, one at 8 o'clock on the lens surface and one at 4 o'clock, providing a balanced design that is engineered to work with the eye's natural blinking motion to stabilize the lens.
Wow. So listening carefully to your patient's needs is important. It's clear that components of both comfort and vision need to be in place to help prevent dropouts and keep them in your practice.
Absolutely. They have to have a lens that will meet their needs. My patients prefer the comfort, vision, and handling of Air Optics astigmatism lenses versus other brands of toric lenses. And the study data also has shown that the precision balance 8-4 lens design of the Air Optics for astigmatism provides advantages with respect to fitting, centration, as well as rotational stability. There also are advantages in vision as demonstrated by patient ratings and preferences versus, a popular lens like Acuvue or Oasis for astigmatism.
So I guess for some of the practitioners who still may be wondering, can you give us a little refresher of who you would fit into these lenses?
Certainly. I think, first of all, for Dailies AquaComfort Plus toric lenses, the candidates include first-time contact lens wearers. That's a big one in our office. We definitely try to move first-time contact lens wearers into Dailies' approach of lenses. Patients who experience end-of-day dryness or discomfort in their current lenses. Patients who have symptoms of ocular allergies, which we've already talked about as a big thing, such as redness, burning, itching, heavy users of computers or digital devices. These days, that's a great thing to consider. Frequent travelers, patients with active lifestyles, and patients who enjoy the freshness and convenience of a new lens each day. I personally like that, and that's why I wear Dailies lenses, simply because I love that fresh feeling every day.
Right. And of course, if you're talking about people who use digital devices, I think you're talking about everybody.
Well,
we're all glued to our phones.
It's more and more. So that's why we're using them even, more for children than we ever thought about doing before. So I think there's a tremendous opportunity out there because children certainly have astigmatism as well. But, if we're talking about Air Optics for astigmatism contact lenses, those candidates include patients who prefer a monthly replacement schedule.
Right.
And there are patients who do that, or patients who are overwearing their 2-week replacement lenses, patients who notice discomfort in their habitual lenses before that wearing cycle is over, and patients who experience end-of-day dryness or discomfort before, again, the wearing cycle is over. Patients whose habitual lenses move excessively. Those are some of the patients that we would consider keeping in a monthly replacement type of lens. But again, my choice always, if I have a choice, is I go the Dailies route.
Sure. It's interesting, I guess, after, speaking with you for all these times, I guess the most important thing that you can do is listen, right? It's the most basic thing, but the most important thing. Listen to the patient and try to really assess what their lifestyle is like before making a choice.
I sure agree with you, and I think that's the one thing that, fortunately, we do in optometry pretty well, but we can always do it better. We can listen and we can make diagnoses much quicker than anything we can do with all the fine technology we have in our hands. It's the listening that helps us the best. I mean, that's just the way it is out there.
Absolutely. So I guess we're just about out of time looking at the clock. And thanks for sort of stepping us through Alcon's portfolio of their toric lenses. Do you have any sort of final parting words for us?
Well, first of all, I always want to thank you guys for having me on the show. My goal in practice is to help all my patients see, look, and feel their best. I mean, that's all of our goals, I think. Recommending lenses from Alcon's toric contact lens portfolio does give me the confidence that I'm doing just that, both for my daily disposable and monthly replacement contact lens candidates. So it not only benefits my patients, but it benefits my practice. at the same time, and I really hope that listening to what I had to say today will encourage some of our colleagues to give them a try. There are opportunities out here that we have no reason to leave on the table. We ought to be involved, and it'll be not only good for the patient, but good for us as well.
Absolutely. Well, thanks so much for joining us today, John, and thanks for everyone out there for listening. And thanks again, everyone. And I guess I'll see everybody online.